Sorry, welcome back.
And
And thank you for staying with us. We're going to be looking at public health management now. Public health initiatives improve and extend lives of millions worldwide. Public health is the science of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, public and private communities. It is concerned with threats to health based on population health analysis. It's my pleasure to welcome to the studio in Lagos Dr. Samuel Akingbenyi, who is the President, Environmental Health Officers Association of Nigeria. Good morning, Doc.
Good
Thank
morning.
you for joining us.
Good morning.
And joining us.
He'll join us later.
Thank you. Thinking about public health, I can't but, my mind can't but go back to those days when I was growing up in Lagos, and we had people who were called Wule Wule, health officers who would go around and make sure that your surroundings were clean. And indeed, without any prompting, people actually cleaned the environment. All that is missing today. And right now, the Environmental Day, which was the last Saturday, today would have been one of such days, has been cancelled in Lagos State. I hear that it still takes place in some other states. What impact is all of this having on the health of the people?
Well, thank you very much. Once again, I say good morning, and the Lagos people, I say good morning. Those days we're talking about, first and foremost, I want to tell you that environmental health officers, who in those days were referred to as sanitary inspectors, still exist. And they are still in the services. Yeah, they do.
In which areas?
They're in the services of the local government, they're in the services of the state, and also of the federal government.
Local government.
State government, and also the federal government. And sure, you can see me in this uniform, it means I'm one of them. And
where do you operate?
I operate in Lagos State.
Where in Lagos State?
I
Lagos
operate in
State
Apapa.
Okay.
Yeah. Incidentally, I'm the head of the Department of Environmental Services in Apapa local government.
Okay, so what exactly do you do?
The responsibilities of environmental health officers is what you just coined out from the public health definition. And it is simply three major things. It is to prevent disease, to promote health, and to prolong life and efficiency. We do this by ensuring that environmental hygiene is of the standard. We educate people to make sure that personal hygiene also is really looked into, to make sure that food are prepared under hygienic conditions, to make sure also that our streets are not littered with refuse, to make sure that households are kept at high standard. I hope you come out of that cough.
Yes, I hope so too. Did you just mention refuse?
Yeah, yeah. Those are what environmental health officers do. We also try and make sure that the environment is made pest-free. Pest control is also part of our responsibility to prevent disease generally. You will see that if all these are taken charge of effectively, definitely, we are going to match up with this, that's saying that prevention is better and cheaper than cure.
Okay. I said someone will join us later. The Commissioner for Environment, Kogi State, joins us via Skype, Dr. Saka Audu. Thank you for joining us.
Thank you. Good morning.
Recently, Kogi has been in the news about issues around public health. And you've heard from the President of Environmental Health Officers Association of Nigeria in Lagos, Dr. Akingbenyi, talking about efforts to ensure that people stay healthy and lives are prolonged. What's the situation in Kogi now, in the face of the recent incidents?
Thank you. First, I want to correct the impression. I am the Commissioner for Health, not Environment.
I said Commissioner for Health. All right, that's good. All right.
Well, what we did was to send our personnel the rapid response team down to the Agba West local government area to actually confirm the nitty-gritty of the widely reported case of a strange disease in Kogi State. Honestly, there's no strange disease in Kogi State. The situation is calm. There are no active cases. So
sorry, Commissioner, cases of what? Cases of what?
Hello?
You said there are no active cases. Cases of what?
Cases of disease.
What, have you been able to confirm what exactly this disease is?
Well, we evacuated about 43 people who we found manifesting one sign of ailment or the other. We transferred them to Kogi State Specialist Hospital, Lokoja, for optimal care. And what we found was that only 6 of them were sick enough to warrant hospitalization. And we did. They were treated within 72 to 4 days, and they recovered 100%, and they were discharged home. Among the 6 people we admitted, 3 of them had symptoms suggestive of gastroenteritis, and the other 3 were treated for malaria, and they all recovered 100%. We went ahead to investigate those cases thoroughly, and what we found that is of note that can be mentioned here is that out of the samples we took, only one of the culture sample yielded growths, and that was Klebsiella. And we all know that these cannot cause disease of epidemic magnitude.
Okay, so you evacuated over 40 people, 6 were admitted. But what is it that will cause that kind of a situation where over 40 people in a particular community will suddenly go ill? And as you say, you've not yet identified that particular illness. So what can cause that kind of a situation? What conditions?
This is not a single community. There are clusters of communities, about 6 of them. In any community, you will always find sick persons. And that does not suggest epidemics.
Okay, Doc. You said that some of them manifested symptoms of gastroenteritis and some others malaria. Am I correct? Dr. Audu?
Hello, sorry, there's a problem with the network.
Did you say that some of them showed symptoms of gastroenteritis and some others malaria?
Exactly, that's what, yes.
In other words, there is no strange disease in Kogi State.
Exactly, that is the message I'm trying to pass here. There is no strange disease in Kogi State. There are well-recognized patterns of passing information when it comes to disease outbreak. We have WHO